But over a year now, the country has been battling the deadly coronavirus pandemic, which has cost the lives of many, as you may well be aware of. Majority of these deaths were, however, said to have been as a result of underlying conditions, especially among the aged. And it seems that many young people consider the virus as the preserve for older people. But recent data shows that everyone, including young people, are vulnerable. Judith Awachitando has been interacting with some youth about this revelation.
Again, according to statistics from the Ghana Health Service, the considerable number of persons who are severely ill are surprisingly relatively youthful persons with no previous underlying health conditions.
That's the President Akufo-Addo during his 22nd address to the nation on the COVID-19 pandemic. The latest deaths from the virus seem to be sending shivers down the spines of many. It has been confirmed that many people in critical condition are young and are without underlying health issues. Meet Lois Bedo-Nkansa, a 21-year-old student of the University of Ghana who was very disturbed about the virus.
So it makes me really worried to leave the comfort of my home, to be in such a big place where I'm at risk all the time, sharing a room with someone in the same dorm, on the same floor. The possibilities are endless with how quickly and how seriously you can get the virus. You can die. Like, it's very mind-boggling.
She admits the hikes in cases should be a big worry to everyone, including young people.
You see, at first, I actually thought that I don't have any underlying problem that could trigger me dying from COVID. But now you don't even need anything to die out of this new virus, this new strain of virus, and it's really scary.
For her, coping with the virus in school has been more than a hurdle.
We can't see the virus, we can't feel it, we can't touch it, but it's there. So you always, like, your life is now pinned to the nose mask, and it's really uncomfortable having to sit with it, studying all night, all day. It's uncomfortable, and all the activities that made school fun have been taken out of the picture all of a sudden, like in a flash. Everything is gone. The drink cups, the social gatherings, like the fun of university life has been cut off so suddenly.
Some others have expressed concern about the way the youth in Ghana have taken the virus for granted. They say they are doing all they can to prevent the deadly virus from shortening their lives.
It has always been scary. We just have to protect ourselves and just follow the protocols. Because as at now, everybody can get in contact. You don't even know who, even the person you're talking to, whether the person is safe or not.
I think in Ghana it's much scary now because you see a lot of people dropping their guards. They are no longer wearing, you sit in the church hall and you see a lot of people no longer wearing their masks and all of that.
It's really, really bad because most of them were thinking that like it only affected the aged, but as it shows right now, that's false. And then I think the youths really need to get educated.
The big call on all is to mask up because COVID-19 is now no more respecter of age. Judith Awachitando's report for JoyNews.
Well, let's take you to the Savannah region. Isaac Nonya is our correspondent there. Appreciate the messages that most of you are sending, ensuring, sensitizing all of us to mask up. Isaac, I understand that the cost of masks is one thing that we are having to deal with in the region. Tell us a bit more.
That is true, because the prices that were witnessed last year have suddenly jumped up. We have the cloth one, which used to be sold somewhere 2 cedis. Now they take it to 3 cedis and 4 cedis, depending on where you are going to buy it from. The surgical one, which was 2 cedis. Some places still 2 cedis, other pharmacies is 3 cedis. And if you observe the purchase per last year, many residents, particularly those in West Gonja municipality, purchased a cloth one. The surgical one was also purchased by those who felt that they
Isaac?
could use it to.
I don't know why I'm losing you because you are stable, but Isaac, go over what you just said. I lost you.
May result to the government ability to fight this pandemic or their own challenge of convicting the pandemic. If it happens, they happen to go in contact with somebody who has.
Hello, Isaac. Isaac, you are breaking. Maybe we can try and raise Isaac back on the line as I take some of your messages that you've sent in. This one doesn't add a name, but says, I think we should go back to the days of the lockdown where we were adhering to the COVID protocols. Mind you, the lockdown had its own impact on our economy, and so the best is for us to keep the economy running, but for us to take care of ourselves. This one says, African leaders must sit up and stop depicting the spirit of ignorance. Can't we rely on our researchers to invent a medicine to curb or cure this COVID-19 pandemic? You go on and on about your thoughts. Thank you very much for sharing that. And this one says the COVID-19 cases are increasing because, I think that I've taken this one already. This one says, I think the law must act now on them. And thanks to the security too for doing a good job. Thank you very much. Let's try Ivy from the Volta region now, see how it's going. Ivy, what can you report today?
Yeah, today things have improved steadily. Some schools like the Zion College in Angloga, the Zico Basic School also in Angloga, and the Ketsa Senior High School face masks, washing their hands before they enter the classroom, and they were also using the sanitizer. So in some few schools, as I mentioned earlier, have been able to adhere to the protocols. So at least with that, we think things are improving little by little. But it's also brought to the fact that face masks, the price of face masks is still going up because of these issues. People want to make money from this. So it's making it difficult for people who cannot afford to purchase it. So for now, some of the schools I visited, as I said earlier, have been able to adhere to the protocols. You see all students in the classes using the face masks and washing their hands with their sanitizers with them.
Which sounds like a good thing, Ivy. Thank you. Hopefully by next week we would have gotten used to, or children would have gotten used to the processes, the new processes before they get into the classroom. Thank you. Ivy Setoji with a report from the Volta region.